Hi, my name is Kineret Sherman. I have something important to share with you, something that's applicable to everybody. And I hope that you'll help me make this viral. In 2015, I was diagnosed with rectal cancer. And I did alternatives for about a year and a half. It didn't regress the tumor, and then I did conventional treatments, which helped me. And I do not have rectal cancer. I am so grateful for the treatments. Yet, after my treatments, I realized that some information was omitted from my care. I'm sure it was a careless error, but I noticed that there were things I didn't know that weren't told. I'm interested in having medical transparency. Just like when a person buys medication and there's all of the side effects that could occur from medication, and this is required. When a person gets treatments like radiation therapy or chemotherapy or other therapies with the surgeries, there's a huge variation of information. And so different patients can receive different information. In my case, and I'll talk about radiation therapy right now, radiation to the pelvis for men and women can have a lot of different effects. In the case of women, because the rectum sits in an area that includes the vagina, the uterus, the ovaries, and the bladder, when an external beam of radiation goes through the body, it gets everything to some degree. And there are effects from all of it. So in my case, I was told that I would go into menopause. I was 43. I would become sterile, which means that the uterus would not be able to carry a child. And I was told that there could be some bladder damage. What I wasn't told was that radiation would scar the vagina, and that sexuality will be painful. And then I wasn't told how to go about being sexual. It took me 2 years researching and looking, and I found solutions to everything. And I wrote a book about it. It's called Healing the Deepest Wounds, Life-Giving Lessons from My Journey with Rectal Cancer. But what I really want to talk about, and what's really important, is that there's such a huge variation of information. Recently, in January of 2024, a study came out, articles came out that said that colorectal cancer has become the number one or the deadliest killer of cancers in men and the second in women. And the age when people are being diagnosed is younger and younger. It's called young onset. I see lots of people in the 20s and 30s and 40s getting a diagnosis of rectal cancer or colorectal cancer. And it's important for patients. It's important actually for all patients to receive transparency, honesty about what will happen. I'd like to read to you from my book some of people's reactions when things aren't told to them and what that is like, so you would understand why it's important to have medical transparency up front. I did a survey of 100 women, and there was such huge variation in the information they received. Some women, 25% were told, that came back to me, were told of all issues. They were given advice, they were referred to the right people, they got things called dilators, great. 12% of the women that got back to me said, and this is out of 100 women, said that they received partial information, and the rest they learned online. They were on colorectal cancer Facebook pages. 63 of the women were not told that there would be any sexual dysfunction. And this is what it sounds like when women find out later, when there's no medical transparency. Tammy from Georgia was told that she wouldn't be able to get pregnant after radiation and that she would go into early menopause. She was single for a couple of years. The first time she had sex, there was so much blood that she had to go to the ER. The doctors acted like she had done something to cause it. She didn't know why the bleeding happened and felt embarrassed by what the doctors thought. No one, including her gynecologist, had told her about the scar tissue. He just said she was having a lubrication problem. She didn't know why sex was painful. She had never been told about dilators. That was 5 years ago, and intercourse is still painful. She says it's frustrating that many doctors don't take the time to discuss how the body will be affected by these treatments. Jennifer was given a printout about side effects to read at her convenience. She felt she had no choice and was already nervous about what was happening, but just how severe the scar tissue was to the vagina and bowels was not mentioned. She learned about it by reading other women's stories online. She wanted to thank me for bringing this issue to the public eye. Lisa's doctors from Oklahoma did not tell her about vaginal effects. She's livid. If she had known, she would have declined radiation. Chemo was enough to shrink her tumor for surgery. Courtney from Virginia wrote that her doctors mentioned these issues in passing, like, oh yeah, by the way, you're going to need dilators because your vagina will shrink. Okay, thanks, bye. End of discussion. She asked more questions. She didn't follow through with the dilators because everything hurt because of radiation. And the last thing she needed was to add more pain. 2 years later, she did pelvic floor physical therapy. She was told she would have to use dilators 2 to 3 times a week for the rest of her life to have sex. She went through menopause at 31 and has zero sex drive. So she gave up on the dilators. Her husband understands and agrees it's not worth it, but being celibate early in life just sucks. Lower libido because when the radiation hits the ovaries, there's a huge reduction in testosterone, and then, estrogen and progesterone as well. Judy shared that her treatment was 7 years ago. She was told nothing about vaginal issues, even when she complained about vaginal spotting during radiation. She felt angry when it was too late for dilators a year later, and she was diagnosed with vaginal stenosis. She uses coconut oil when she does have sex, which is rare, and her partner only fits part way. She has to be on top to control the depth. It's like hot fire poker feeling sometimes. It just burns. It's not fun and not worth it. She can't have a routine pap smear. The top of her vagina is webbed and closed. It's a nightmare. She wishes she had skipped radiation, but then wonders if she would still be considered an ED, no evidence of disease. The stories go on, and I wish that I could tell you that it was just about that, but it's not. As I've started to speak out, people have been writing to me. One woman shared with me that her brother had throat and neck cancer with no history of smoking or drinking. He was told about possible dental cavities that would develop from radiation treatment, but was not told about the burning of the skin in his throat, the extreme difficulty swallowing the need for a feeding tube shortly after the chemoradiation treatments, the loss of taste, the need for taking supplements, and the ongoing lack of energy. 3 years out, and he's still having the same symptoms. And my friend Michael lives in the United States. He had prostate cancer. And 7 years, he was treated by surgery and radiation. 7 years later, he started having what is called radiation cystitis, which is an inflammation of the bladder. There's a lot of blood vessels that happen, and then he can pee blood. And this, in the 7 years since, this has gotten worse. He was never told that radiation works for 20 years in the body. I was not told that radiation works for 20 years in the body, and that effects could start, 5 to 7 years. I looked at the consent sheet that I signed. There was nothing that said that there were issues could develop 5, 10 years down the line, and nothing in my consent form said anything about sexual issues, vaginal damage, scar tissue. So the issue is not about vaginal damage. The issue is medical transparency. Definitely in radiation treatment, but everything. Just like there is, I'm going to say it again, a person takes the medication, there's a list of the effects. Well, before people get treatments, they need to have a full list. Not a huge variation that some people will go, let's say, to Memorial Sloan Kettering and be connected with all the right people before treatment, will have proper consultations before treatments, will be connected to a sexual health nurse or therapist, gynecologist, urogynecologist, pelvic floor therapist before treatments. And other people in the United States don't even know if they can get pregnant after radiation treatment. Why? Because there's no uniformity in information given to people. So what do I want? I want a universal sheet, for what's going to happen with treatments. It has to be spelled out. It's amazing to me that someone can go into one place and be told 10 things that are going to happen, and another person goes to the same kind of treatment and we'll be told 3 things or 4 things. Why? There's no uniformity in the information that needs to be given. In my opinion, and I'm not an expert in this, there are experts that can handle this. My job is to report and lobby. But everyone here will know someone affected by cancer. So from my humble opinion, I would be interested in having several modes of information critical before a patient starts any treatment. What will happen? What is the dosage? What's the % survival with or without? A sheet of paper about all the possible effects, a video about it, and referrals to all the people who will need to care for the person after the treatments, but before. It's like having shared decision making, trusting the patient to know what kind of quality of life he or she will want to have after. It's being brave. It's being honest. That's what I want. Help me make it happen. I wrote this book. That's one of the major intentions of this book. I've spoken at USC and UCLA, and I'll keep doing videos and figuring out how can medical transparency come up the scale of integrity, come up into a place where there's uniformity and the patients are cared for and consulted with uniformly. Thank you so much for listening. And if you found this valuable, if this is something that you resonate with, please share it. But not just share it, write something. Tell people this is important to watch. It's important to effect change. And I'm not a celebrity. I'm a kind of unknown person. So I can't do it without you. Help me. Thank you.